37 weeks pregnant, it is a term baby. It's a term baby. How much is the fetus measured in weight? The fetus's measurements are about 48 centimeters from head to toe and it weighs about 2,900 grams. Starting at week 37, the newborn is considered a full-term baby. The fetus continues to accumulate fat under its skin which, after birth, will help regulate body temperature and maintain correct blood glucose levels. In this week, the fetus is usually in a cephalic position, head down. Only 3% of fetuses are in another position. However, although it is usually very rare, it is still possible for it to roll over, so if it maintains a position other than cephalic, it is likely that a cesarean section will be proposed that will be scheduled around 38 or 39 weeks. If the patient wants a vaginal delivery, external version maneuvers can be performed at 37 weeks to turn the fetus towards its cephalic presentation. However, it must be taken into account that there are some absolute or relative contraindications to performing the external version, including multiple gestation, placentation abnormalities, such as placenta previa, maternal infections, such as HBV or HIV, Rh isoimmunization, ruptured amniotic bag, coagulation disorders, previous cesarean section, small fetus for gestational age, hypertensive disorders of pregnancy and labor already established. Changes in the mother. The neck of the uterus begins to mature. The cervix usually begins its maturation weeks before delivery, so sometimes there may be small spots of blood or expulsion of the mucus plug, a sticky brown or transparent discharge. From when the mucus plug is expelled until delivery occurs, hours to weeks can pass. The expulsion of the mucus plug is considered something physiological in the process of pregnancy. However, if the bleeding is equal to or greater than menstruation, the pregnant woman should consult her referring doctor. Other red flags that require medical evaluation would be the onset of regular uterine contractions, for example, contractions every 3 to 5 minutes for 60 minutes, rupture of the amniotic sac, or decreased or absent fetal movements. Specifically, fetal movements are one of the first signs of fetal viability. They are usually detected by the pregnant woman after 18 weeks. They translate a situation of fetal well-being. After 34 weeks, they can decrease slightly without indicating a fetal problem, since as the fetus grows it has less space in the uterus and its movements become more limited and defined. The acute absence of fetal movements for more than 2 hours in a pregnant woman who previously perceived them, as well as the subjective perception of a decrease with respect to the usual pattern of fetal movements for more than 12 hours, require a consultation with the doctor. The most common cause of decreased fetal movements in a baby who had previously acquired them correctly is placental insufficiency. Pregnancy control. Diagnostic tests, vaginal tact. In case of uterine contractions, the gynecologist performs a vaginal examination to see the characteristics of the cervix, dilation, consistency, hard or soft, position, posterior or centered, and shortening of the cervix are assessed. Usually the shortening of the cervix occurs before the dilation, and as it is modified it is shortened, softened, centered and opened. Until this week, third trimester tests can be performed to assess anemia, repeat toxoplasma serology if the pregnant woman was seronegative, and look at coagulation with a view to administering epidural analgesia if the pregnant woman so wishes. Thank you for watching this video. If you liked it, please share it and subscribe to our channel for mothers and happy pregnancy. Every week we upload a new video with very good information. Thanks.